guys, in this video I'm going to talk very briefly about a condition known as FAI. I recently had a client come in who was diagnosed with FAI and who ended up getting surgery, and so I wanted to just do a little short crash course on what it is in case anyone has been diagnosed with this or who doesn't know what it is, what to do about it, and all that. So what is FAI? FAI stands for Femoral Acetabular Impingement, and it is essentially a bony morphology of the femoral head-neck junction. So you can have three different subtypes. There's the cam morphology, which is the bony bump that we see, the pincer morphology, which is essentially an overgrowth of the acetabular rim, the superior rim, or you can have mix, which is some of both. So just because you have this on an x-ray doesn't mean that's where your pain's coming from. It doesn't mean it needs fixing. It doesn't mean you need surgery. It's just something that developed in your body probably years and years ago. So let's get to that. So who gets it and why? We see it in skeletally immature adolescents who are playing a lot of sports where we go into flexion and rotation. So it's very common in hockey players. It's very common in soccer players, basketball, these different sports that are putting a lot of forces in those directions, flexion and rotations, in a skeletally immature hip. And so what happens is those forces cause the bone to lay down more bone, and then we start seeing these morphologies. Then the person matures skeletally, everything fuses, and now it's just what it is. That's just the way your hips are. It's bilateral a lot of the time, so both sides, right and left. And then sometimes later in life, someone does something, maybe an overload, maybe you run a marathon, maybe you have a period where you're inactive and then you start being active again, and then we get pain in the hip. And then that's when we get x-rays and we get the diagnosis, and then we have FAI. But it didn't just appear there. It appeared years ago, usually when you were skeletally immature. So that's one category of people. The second are different hip conditions can predispose you to this. Things such as AVN, leg calf Perthes disease, these different things that some people can get. Surgery, these things can lead to morphology, the same morphology as well. Genetics does play a role, we do see. But for the most part, it's most common in, like I said, these active adolescents. Then later in life, pain arises. And the research isn't clear on why. Like, if you have it on both sides, why is there pain on the right and why isn't there pain on the left? Like, that's what is the unanswered question right now. And so you will hear a lot of different things from different people, from different PTs, from different chiros, different surgeons. So that leads me to my next point, which is you need to treat the person and not the x-ray. And this is a problem because people have it on both sides, sometimes go to get surgery on the one side that's painful and that they've tried everything and nothing's worked. And then the surgeon wants to do it on the other side as well because they have it. They just say, you're going to get pain anyways, might as well do it. And that's what happened to a client of mine. She had surgery on the right for FAI. The surgeon wanted to do surgery on the left and she had no pain on the left, but she still had the signs on x-ray. So that's confusing to people because it's like it doesn't hurt. So why are we doing surgery on it? So you want to treat the person and not the image. And that is why the field came up with two different names. So there's FAI, which is the radiographic findings, and then there's FAIS, which is Femoral Acetabular Impingement Syndrome. And a syndrome is a collection of signs and symptoms that lead to pain or dysfunction or pathology. And in this case, we need three things. You need the positive findings on imaging. You need the positive test, which is the FADIR test, flexion, adduction, internal rotation, as in that causes pain. And you need pain. You need those three things. Then we make the diagnosis of FAIS, and then you start conservative management, which looks like PT and rehab and seeing someone like me. If you fail that, and I would give that months, I would give that like 6 months, depending on the person, 3 to 6 months. And if that's not helping, you're not getting anywhere, then the next step would be potentially injections or potentially referral to a surgeon for a consult. That's usually how it goes. My one caveat here is if you failed PT, really, did you fail PT or did that program not work for you? Because a lot of PTs are different. A lot of physical therapists are not trained in strength and conditioning. And if you're a high functioning, very strong person, you have a lot of goals, you're taking high impact, you will need a progressive rehab program that's individualized to you, that fits with your goals and fits with who you are. Because a 40-year-old person with pain on jogging for 2K is different than a marathon runner, a trail runner, someone who wants to do CrossFit, someone who wants to jump, these high impact activities. Like their rehab is going to look different. And so all I'm saying is get a second opinion or a third opinion. You can use people online these days. You can find someone who knows FAI, has worked with it before, knows strength and conditioning, knows rehab, understands limitations and what you can do, what you can't do, what's good pain, what's bad, and all of that. So unfortunately, it's not an easy process. If you're working with someone who's just treating your imaging and not treating you, as in you don't have pain, find someone else. And if you failed PT, as in you still have a lot of pain and you've tried doing bridges and squats and lunges, work with someone else, I would say. And if all else fails and you need surgery, it's a very good surgery. It's a safe surgery. People do usually really well with it. The rehab is a long process too. It's not going to be, just better after surgery, but a lot of times the pain is better. So surgery can help with pain usually faster than conservative management. Conservative management takes time. It takes time to get the inflammation down. It takes time to build strength and motor control and manage your lifestyle and all of that. Surgery, I could talk forever about surgery. There's a lot that goes into getting surgery and the rehab and why did surgery help. There's a book called Surgery is the Ultimate Placebo by a surgeon. If you're interested in that, you can read that book. So yeah, reach out to me if you have questions, if you need help with this. I can help you find someone in your area. I can work with you. I can refer you free resources online. Like there's so much we can do. I want people to live their life, not be held back by pain. And so I'm very passionate about it. But thanks for watching. Peace.